SPSM Chat 2.0 reboot. And each week I do say this as everybody comes back into the fold and gets used to it. No, I am not April Foreman. My name is Anne Marie Matulis. I am the director for the Bristol County Regional Coalition for Suicide Prevention in Massachusetts, but my role here is probably more as chair of the American Association of Suicidology's Committee for Impacted Family and Friends. And we have our guest this evening, Doctor, right? It just changed your profession for you, right?
You're not the first one to do that, Anne Marie.
That's a
Judge Wen is here, but Tracy, you want to say hi before you sign off on us?
Oh yes, hi everyone. Tracy Medeiros. I'm a suicide attempt survivor. Also a loss survivor. So I'm looking forward to listening to Judge Wen speak on this topic. I'm very excited, and I hope I learn a whole lot. And so I'm going now.
All right. Bye.
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 And Judge Wen, if you just want to say hi to everybody, and then I have a little bit of intro, and then we'll get back to your questions.
I will. And I just want to say thank you so much, first of all, for this amazing opportunity. And I'm so excited to be here. And hi, everyone. This is really a joy for me to connect with so many people and family members and advocates out there. And I'm looking forward to a really wonderful chat.
Cool. So everybody, I just wanted to go over a couple of things before we start with this. What I anticipate is going to be a very energetic and exciting and engaging conversation with Judge Wen. A couple of things that came up this week, and I just wanted to touch base. We've been playing around with a new hashtag, and I just would like to throw it out there for you to think about and maybe start using. And it's hashtag normalize the convo. And one of the things that has happened at last week's Twitter chat, we were all Twitter with no video, and we put this out there and came up. And one of the questions was, well, how do we do that? How do we normalize this conversation about suicide? So it's as common a discussion as it is about cancer, even HIV. Everybody talks about cancer and all kinds of other public health issues, and we still cringe around the S word. So we're going to be throwing that out there from time to time. Had the opportunity this past week to actually get an investigative reporter to use that term. I was brought on board NECN Cable News, which is NBC 10 Boston. And Allie Donnelly was the investigative reporter, and we were talking about different things in suicide prevention and mental health. And she actually used the phrase, and I almost jumped up and down and cheered when I heard that coming from broadcast journalism, that maybe that's what we can start. And one more thing is that I had a most interesting conversation with a middle school last week who are going to begin a mental health club in their middle school. Now, oftentimes communities are reactive, not proactive when it comes to suicide. Yes, they lost a student. There are two students in that school who are siblings, and they lost their 14-year-old brother last fall, and they wanted to take some action. And I have to give a huge shout out to the principal at the Brennan Middle School in Attleboro, Massachusetts, because he's taking the bull by the horns, and he offered this forum to the sisters, and they're taking it and running with it. And there's going to be education and training with staff and parents. So if you have that kind of great stuff to tell us about, please direct message or email me so that we can get this information out, because sometimes those little community tidbits can set off a whole movement. After all, that's how the Impacted Family and Friends got started. Simple little community thing that got running. And now, ta-da, we need a drum roll. Okay.
Or at least about us, right?
Yeah, at least about. Our guest tonight is Judge Ginger Lerner-Wren from Broward County. I know that many of you have commented during the week that you have already read her book. This conversation is about way more than that. Judge Wen, did you have any further introduction before I start peppering you with questions?
No, not at all. Please continue on.
Okay. So for those of us who are family and friends and mental health advocates who are watching tonight and participating on Twitter, would you please tell us, though, a little bit more about yourself, your pioneering work in establishing that nation's first mental health court?
Thank you. You know, I will. The mental health court, first of all, really is not a new innovation. Believe it or not, and it's hard for me to believe it. Really takes my breath away that this January started my 21st year on the bench.
Wow.
And I know I started when I was 12. And, you know, I was very, very fortunate in my career. I really wanted to somehow find a place in the law that I was, you know, really doing humanistic work. I was doing public interest work. It really took me quite a little while in the beginning to find my fit as a young lawyer, but finally I did find my fit. And I was appointed by one of our chief judges back in the, I guess around 1993, to serve as the public guardian for Public Guardian, where I directed the Office of Public Guardianship. And essentially that is a probate program. It was a court program at the time in Broward County. And I'm sure that most of your viewers know where Broward County is. First of all, we're about a half an hour, 35 minutes if traffic isn't too bad, north of Miami-Dade. The largest city in Broward, of course, is Fort Lauderdale. Obviously, I'm not in my courtroom. I'm in my living room. But the Office of Public Guardian, I was really responsible for the health, safety, welfare of adults, not children, but adults who were deemed incapacitated by circuit courts and required a legal guardian, that they didn't have any family members, they were indigent, they were alone, and they needed somebody to take care of their where they live, their economic benefits, and of course make medical decisions for them. And you know, it was in this role that I was just dealing with individuals with all kinds of disabilities. And there was a period, a very strange period of about 10 days in that office, where 3 different groups of family members just came unannounced to my office and were absolutely pleading with me, Anne-Marie. They were desperate. They were just in absolute angst. And they all said amazingly the same thing. Someone told us that you could help my mother, or you could help my sister, or you could help my brother, you know, finding mental health treatment in our community because they were not able to secure any treatment. And, you know, as my program was for people who did not have family members, and I listened, and I just, it was heart-wrenching. And as I remember this like it was yesterday, and as I walked that last family down the corridor to the elevator, you know, I made a promise. It was a silent promise, but it was, you know, if I can do anything for these family members to somehow, you know, find mental health services and help them secure treatment and services, I would. Of course, fortunately, synchronicity came into play. And within 3 weeks, I got a call asking if I would be willing to take on a very, very high-profile, somewhat controversial role, overseeing a federal class action involving South Florida's Regional Psychiatric State Hospital. It was a very, very interesting, sometimes traumatic role. But of course, I made a promise. And there I am now practically living in a psychiatric hospital. I had carte blanche in that role over the hospital, but the consent decree that I was overseeing, ironically, gave me the skill sets I needed in order to do what I had to do in order to create a diversionary, specialized mental health court that was really what we still to this day describe it as a human rights strategy in order to stand up, if you will, against the criminalization of people that were being arrested largely because they could not get access to care. And so those are the skills that I brought to the bench when I was elected in 1997. At the same time, ironically, my criminal justice system was going through a series of precipitating problems, largely focused on the overrepresentation of people being arrested with serious mental illness. There was a very high-profile case involving a young man named Aaron Wynn, largely the catalyst for the for Broward's mental health court. And it was really through, again, this very, very ironic set of circumstances, I think, that when I came to the bench, they were looking for solutions, looking for something that our community could do. The mental health court was really, the concept was born out of a task force process, a scathing grand jury report. It's all in the book, but basically, you know, to sum up on that issue, I was prepared to really start and operationalize the court.
And I can tell you the feed is following through. And I wanted to share with you something that Dr. April Forman had said, is that yes, often impacted family contacts someone like you or herself in her profession, because they're worried about a loved one at risk, and the path toward forward is often so unclear and tough that they could end up with you. So moving forward, so you're an author. We know you're an author.
I am.
Yes, you are. And you write often about a term that I found new when I was reading your book. I don't hear too many people around here anyway talking about problem solving. Problem solving in courts just didn't quite gel well necessarily. And so I guess I take that I love the outside the box, cutting edge, revolutionary approach to things. And that's what this sounds like, because from everything that our conversation earlier this week and what all the reading I've been doing with this, that your court's a problem solving court focuses on the root cause of behavioral health issues, offering treatment over punishment. I love that, treatment over punishment. And I know that's correct. Can you expand on that a little bit for us?
I can. You know, the first problem solving court, believe it or not, and it strikes me as somewhat ironic, was in Miami-Dade in 1989 under the stewardship of former U.S. Attorney General Janet Reno, when she was acting as the Dade County State Attorney. And, you know, Janet Reno, of course, was a policy wonk. She, during the 1980s, when, you know, there was cocaine cowboys and, you know, Florida was just flush with individuals just getting, you know, arrested, and they were on felonies for cocaine possession. And she was literally watching, you know, just hundreds and hundreds and thousands of people get arrested. She realized that there has to be a better way. At the same time, we had an emerging law reform movement in mental health. Mental health law was just really coming out of the University of Miami with amazing professors by the name of Bruce Winnick and David Wexler. They began writing scholarship with regards to a law reform science called therapeutic jurisprudence. It really blended perfectly with problem-solving courts, asking the essential question: can courts act as therapeutic agents? Do courts have the power to heal? And so the first drug court emerged in 1989. And of course, we've got thousands of drug courts, mental health courts, domestic violence courts, veterans courts, and the varietals really keep continuing as communities are really vying to fill gaps and in policy and resources, and find creative ways of dealing with vexing problems. The criminalization of people with mental illness being a very, very serious vexing problem.
So my favorite question as a grant writer and as someone who works really hard on sustainability of the projects that we have in our nonprofit. So how's the court funded?
Yeah, you know, that's a really great question, because looking back, you know, when the task force was meeting and they didn't have any money. There were no grants. There was no political will for specialized law enforcement teams like CIT teams at the time. And the one thing I think, Anne-Marie, that we learned about that task force process that literally lasted over 2 years was the power of relationships, the power of building relationships and what communities can achieve through collaboration. And so we might not have had, you know, a grant or funding, but one thing we had, number one, we had shared vision. We had community buy-in. We had a level of bold, courageous consciousness in our community that, you know, we had to do something, that we had to show our family members that there was a judge. Maybe the court wasn't going to work. Maybe the diversionary process would have been too complex. But, you know, I think when we started the court, at least what I thought about the court was, you know, at the very worst case scenario was there was going to be a judge that would stand up and articulate and communicate to our community that we were not going to do business like this anymore. We were not going to turn a blind eye and just see individuals that, you know, really needed mental health treatment, needed care, getting jailed, you know, in our local jail system. And of course, we looked at the court back then. Yeah, we didn't have funding. And yet these community stakeholders, these providers across our entire county-wide system, you know, all were willing to basically break down their service models. You know, Florida is essentially 50th in funding, and yet they were willing to share their resources with a judge in order to, you know, have individuals literally through the court, using the court process as really a funnel, taking individuals out of an inappropriate system of care and moving them into a more humane and appropriate healthcare system, particularly looking to find, if you will, those, you know, that were the sickest of the sick, those that were getting arrested when in fact they needed to end up, you know, in a hospital setting. And for the first time ever, we had two very, very siloed systems of care, never integrating before, never working together, now working together for this really, I think, extraordinary purpose. And that is to ensure that individuals not only have their, you know, freedom, if you will, and we're no longer confined, but we're getting the health care that they so desperately needed, with a court that would oversee accountability. Accountability to who? accountability to what? You know, a lot of people think, oh, it was the court participants accountable to me, the judge. That may be so, but in truth, it was holding the system of care providers accountable to the community, accountable to the families and the individuals who needed the care. It really was, I think, and to this day remains an extraordinary feat. I think.
We have some comments and a couple of questions. One of the things that April commented on again, Dr. Forman. She loves the comment about the therapeutic agents. Yes, they can. And that in Baton Rouge, their parish prison is the largest mental health inpatient unit in the region. #unjust. Impacted families. But we also have a question. I wanted to read this one first. We recently started a mental health court here in Independence, Missouri. Our county decided after much debate that it's a good part to have. Before, we didn't even debate about having a court specifically for mental health situations. Can courts act as a therapeutic agents? That came from April. But we also have a question that is clearly in your ballpark. Can you please explain what a mental health court is?
Absolutely. You know, this court is really has a specialized docket. It is a voluntary court, and it was created essentially to respond to the problem. How do you define the problem? Well, the problem we recognized, and again, this is going back to 1997, was that we were watching individuals end up in our local jail when in fact they needed to connect with mental health services and treatment in the community. But largely access to care was not available. So the court was established in order to link individuals with individualized treatment comprehensively and really help individuals develop their vision of recovery and really take the court and basically take a court of law that people tend to think, you know, what's a judge's role traditionally? To adjudicate, obviously, to call balls and strikes. But we were literally taking a court and we were turning it inside out and applying the therapeutic jurisprudence of, you know, social science. You know, now through that, we were giving voice to the individuals that we were seeing. You know, we were coming from strength. We're promoting dignity. We want to convey that we are here for you, that, you know, we care about you, that we know there's stigma, that we know that there's a lot of denial, that we understand the marginalization, we get the trauma, you know, we understand the hardship, and we are literally here to serve you. The idea, you know, that dignity became and remains the centerpiece of Broward's mental health court because we, again, consider this a human rights, you know, a human rights strategy. This is a fundamental matter of human rights when Americans who need access to mental health care are ending up in jail. Still, to this day, it's unconscionable to me to think that that could happen in America. And yet, you know, it does. And there's hundreds and thousands of people, as you just said, Anne Marie, and your listener, you know, behind bars, largely as a result of not accessing treatment.
Oh, absolutely. Absolutely. And the feed keeps rolling. Let's move you along. So the whole point, of course, of the SPSM chat, or primary point, is suicide prevention social media. So let's talk about that. So one of the key goals of suicide prevention is to overcome stigma surrounding mental health. You know, and I really don't like that word. I usually use judgment, prejudicial judgment, and discrimination. and need to engage the entire community in suicide prevention. So I've heard you talk about your stakeholders, but how does that judgment, that prejudicial judgment and stigma impact your work in the court?
It's everything. I mean, I just think it's everything. And, you know, for your viewers and your listeners, first of all, you know, the court has a clinician embedded in the courtroom.
Oh.
And so all of the psychiatric triage, screenings, assessments are literally done out in the open. That was intentional. You know, we wanted, I've heard, Paul, from the CEO of Mental Health America talk about taking the fight in the open. We really feel, just as talking about suicide in open court, we really feel that we have got to normalize these conversations, that we have got to be able to inject hope, thank you, that, we have to be able to be authentic, vulnerable, and be able to talk about the facts. We have got to know the facts. Treatment works, recovery is real. Suicide prevention is everything. Everybody has a role to play in suicide prevention. And yet, I'm embarrassed, Anne-Marie, in a sense, to say it took me years to elevate suicide prevention to the place where I think, quite frankly, it absolutely needs to be in all of these family courts, problem-solving courts, juvenile courts, drug courts, veterans courts. We really must elevate suicide prevention so that we are talking about it from the bench. Why? Because when a judge says something, and I'm not trying to be whatever, but when a judge says something, it's like we have a bullhorn.
Yes.
Every word is amplified. And, we need suicide prevention and awareness to become amplified. I think judges are heroic champions. We must champion suicide prevention, just like we champion drug courts, veterans courts, and everything else that we're doing.
I'm ready to stand up and cheer, roll the drum. Every time I hear someone say normalize the conversation, I want to jump up and say, yes, 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 yes. Now, I know that you know this, but one of the struggles we have, I just did a training yesterday. Tracy and I were up in New Hampshire doing a training yesterday. And we keep hearing the same comments over and over that how do I get those at risk? First of all, how do I start the conversation? But then secondly, how do I get them into care? Because they are so reluctant for all the reasons we know. They don't want to end up in a court. April had a comment that so much easier in Baton Rouge, Louisiana to get to jail than it is to get mental health care from that perspective. So with so many people still being so reluctant because we haven't normalized the conversation and to engage them in care, have people been reluctant to come to the courts? Have people been reluctant? Have they been afraid that the same things may happen to them? What's happened around that reluctance?
I think that it's all of, and I think you'll agree with this, and I think your viewers will agree with this. It's all about building connectivity and building trust. And so in this kind of a court process, problem-solving courts use TJ, therapeutic jurisprudence, we really call TJ. The idea is to understand, that there's forces in a courtroom. It's how we speak. It's what we say. It's the formality of a courtroom that oftentimes leads people, to not feel that they have necessarily been heard, that they've been listened to. And so from a TJ vantage point, all of these soft skills, active listening, to be able to storytell, to be able to validate what you are hearing, to feel the idea that a judge could feel something and be empathic on the bench and say, I have to tell you something. We care about you. You know, you have incredible strengths. We want you to live your dreams. You know, let's braid in the data. Let's braid in the facts. This is what happens, you know, when there's untreated mental illness. We know what happens. We know the consequences. We understand adverse childhood experiences. We understand trauma. Let's talk about the ACE study. Let's, you know, connect the dots. People want to learn. They are interested as long as we can develop a level playing field. And that's the beauty of TJ. We can do that, you know, if people really believe, I think, that here we have a judge, court staff that really not only cares about them, but will do everything possible for them in terms of advocating for services that, you know, really certainly in my state and certainly around the country, you know, are very difficult oftentimes to access. So to use the currency, the authority of a court, I think, to help tell the story of why linking with mental health care is so important, as it is with any kind of medical care. I think that people really, it helps break down, that shame, that whatever you want to call it, those barriers. We don't have to stigma, prejudice, whatever, discrimination. We want to eliminate those barriers so that we can really help those that are before us and their family members.
Hang on, I have a question for you. And where did it go? April, where did you go? I'm sorry, I'm just trying to hold on. April had a question. Impacted family often will contact me, a clinician, about a family at risk that is refusing care in and out of hospital and jail. I don't have much power as a provider. I have to refer to the legal system, and the family often feel discouraged by that. But that was not the question that she had. And I'll just keep looking to find it, okay? Because
Sure.
Because it was important. And so what happened is so many came into the feed, it bumped her right down.
No problem.
So while I'm looking for that, I'm going to ask you another question. So in your book, you talk about many things, and I found it a very compelling read. I loved the way the stories, the personalization of the stories were in there. But I was surprised to see the court of any kind and zero suicide in the same sentence. That was new to me. So in 2015, you declared the mental health court a zero suicide initiative.
Actually,
okay, I have to ask, what prompted you to do that, and what does that really mean in a court?
Exactly. I think that's a great question. But a few things happened, and the one thing is that I serve on the executive committee of the National Action Alliance for Suicide Prevention, and thrilled to do so. And as I got upstream, on the Action Alliance, I really recognized, with all due respect, for everything that we were doing, I wasn't doing enough. And I started looking at the data. First, the CDC report is coming out that more teenagers are dying from suicide than they are of traffic crashes. And then I just felt this is compelling. Our rates of suicide are just rising, and they're continuing to rise. And I'll never forget, even I was speaking at an executive forum in Albany, New York, for NARPIS. And as I'm listening to a speaker across my phone comes the New York Times article, U.S. suicide rate surges to a 30-year high. And I just remember thinking to myself that I needed to be able to communicate. How how am I going to communicate that I am now elevating suicide prevention, through the court process? It's not part of the court process. It's not part of the clinical screening process. It is now the #1 paramount priority in the mental health court. And, using, if you will, sort of co-opting, I suppose, the Zero Suicide Initiative language as an aspirational message. I understand zero suicide, is related to healthcare and systems of care and all that. And yet I needed to be able to be clear. I needed to be able to convey a clear vision of what it is we are trying to accomplish. And what we are trying to accomplish is we want zero suicide. Of everybody that's participating in the court, we want everybody listening, lawyers, court staff, correctional staff, public people in the court. Every time we talk about suicide in the court, other people are listening. I want a tipping point. I want a contagion. I am looking, in order to normalize, destigmatize, demystify, the idea that we have got to use language. We have got to talk about suicide prevention. We've got to talk about the data. I have got to be able to make sure everybody in my court has a safety plan, has local resources, has the national lifeline, knows that we have mobile crisis teams. I want families to know, to empower themselves, to feel confident that they could manage emotional problems so long as we're not afraid to talk about suicide.
Okay, I have two questions. One is from Dr. Forman again, and one is from your colleague, Victor Armstrong, that I know you, one of two Vics that you and I both follow. All right.
Right. Every Sunday morning, he's there.
Yeah, I know. I watch it. I watch for it. So a quick question. In April's just looking for some thoughts. So when we have situations where someone's suicide risk is chronically high and the family struggles with that revolving door of the emergency room and police contacts. So what are your thoughts on that? When you have someone so chronically, and I think it ties into some degree, because if we don't get that person help, then they fall into the question that Victor is asking, and he wanted you to speak to how suicide is the leading cause of preventable deaths in jails. And then he has other questions too. Well, I'll throw those two at you right now.
That's a lot to unpack. I think, but I want to start with diversion. And, Victor makes a very, very important point. And, we really have to recognize the risk, the intrinsic risk of incarceration in local jails for people with serious mental illnesses. That's #1, or depression, or, just toxic stress. And so everything that our communities can do in order to keep people out of jail, quite frankly, we need to be able to do that. And so these strategies of mobile crisis teams, specialized law enforcement teams, mental health courts, and, everything that we can bring to bear, I think we need to bring to bear. And it's just not me, it's also other experts. Back in, I think, 1999, Human Rights Watch came and sat with me in Broward's mental health court. They were doing a national survey on the criminalization of individuals in maximum security prisons in the U.S. And they cited Broward's mental health court, which I'm proud of, as a recommendation to get people from escalating and further penetrating the criminal justice system. Get them out, link people to the care holistically and individually that they need. And we will not only save lives, but we will save incredible, dollars in terms of this endless cycling and, of course, of the potential threat of fatalities in U.S. jails and prisons. Now, we've read about these horrific, tragic cases, all over the United States. This, to me, Anne Marie and others, and Vic that are listening, this isn't rocket science anymore. These problem-solving innovations, these diversionary innovations, and basically moving our systems of care to a more preventative, approach. What I'm questioning, and I'd like to know the answer, is why, have we been so slow in terms of advancing systems of care, to prevention, when we all recognize, that this becomes really, I think, an essential, advancement that we must have in the United States. For all our families, we all must have, excellence in access to behavioral health care, as all medical care.
Oh, and wow, I wish I had a calm and easy answer for that, because I keep saying the same thing. We talk here now in community outside of a prison setting, Judge Wen, I live in a county that has had extremely high suicide rates, as we talked this week. County of 50,000 people, 500,000 people, 20 cities and towns, 86 confirmed suicides for 2018. And that's just those that are there. That will increase by 10 to 12% within a year and a half after the state does its data. And it's hard. It's hard because we end up being reactive. And why do we wait until that tragedy, till that crisis, whether it's in schools or in community, in jails? One of our jails down here has been on national news for having an extremely high inmate suicide death. And yet I know there are a lot of really positive things that can come out of it. I try to focus on that. I always look for what resources do we have? How can we fill the gaps? And I think we do a damn good job of that down here. And I know many people do across the country. And then that brings me to the next leading question for you. So that sounds like advocate, activist, champion. So tell me, because I'm sure that when most people saw the title of tonight's chat, they went, what? Judges as champions? And if people have had just even a cursory touch with the court, might not think that way. And then others who may have had really wonderful experiences. But when we're talking about championing for suicide prevention, how do you believe judges can do that?
Well, because we're already championing, for public health. We're already championing for behavioral health. Like as I started off, talking about problem-solving courts, we've got, thousands of drug courts in the United States. We've got hundreds of mental health courts and veterans courts. We now have on the civil side of the legal system, Anne Marie, which I think, again, always responding to these crises. We've got safe baby courts that's responding to the opioid crisis, and all these children now that are flooding in states, the foster care system. And now we've got these 0 to 3 amazing collaborative courts that are bringing expertise in early childhood development into the courtroom. So in other words, across the entire jurisprudential landscape, we're already doing this work. We're already championing behavioral health and public health. The issue is, can we take that one more step? Can we do, doesn't cost a penny, it doesn't cost anything, it's just one pivot, if you will, to take that suicide prevention piece and elevate it up there through court process and make sure it's embedded, you know, throughout court process. That's all it is. And I'm very positive that we can do that. And I just think we need, you know, we need more leadership in terms of those in justice policy centers to say, yeah, we need more judges, you know, to stand up and talk about suicide in the courtrooms, in the chambers, in the courtrooms. And that way, I think once we begin doing that, other community sectors, the public sector, the private sector, I believe it's those tipping points that you talked about, Anne-Marie, when we started. You hit the nail right on the head. You know, we have got to go ahead from all these different sectors and get that tipping point, correct? To move forward in suicide prevention. And I really believe, and I know I am the eternal optimist. I've been accused of that by many people. And
same here.
You know, when you live and you breathe, look, no money, Broward County, in a part-time court. I have a regular division. Now I took up another part-time drug court. I'm doing 3 courts, whatever. We've diverted over 21,000 people out of our local jail. It's extraordinary.
Wow.
And yet it's not rocket science. It's just literally connecting people to the care that they need through a structural court process with, you know, collaboration of individuals all working together. We can do this. And, you know, I was just noting that something very interesting in the news, and I was talking to my students about this today online, and that is that tomorrow in the state of California is going to swear in their very, very first Surgeon General. And Dr. Nadine Burke-Harris is a pioneer of adverse childhood experiences, and she is going to bring all of that knowledge forward on prevention, on how to respond to serious, you know, chronic medical conditions and behavioral health to the state of California in a unique leadership designated post of Surgeon General. You know, we need suicide prevention czars, you know, on the county levels. We need them on the state levels. You know, we need to bring our knowledge and our passion to bear. You know, I think from a governmental vantage point, and I think we can make a tremendous difference through that kind of transformative leadership.
Wow. Do you realize what time it is?
Not really, no.
Okay, we have about 10 minutes left.
Uh-oh.
So, well, we've made it through most of it. There are a couple of other important questions I would like to, I'm just checking the feed, that I would like to get to. And I have to tell you, this feed has been beeping off the hook here. So,
oh, wonderful.
So one of the things I want to let everybody know is,
thank you to my Twitter community and my students if you're on.
Yeah, is that what we will be doing is as we do every week, we will be curating this into what's called Wakelet. And so tomorrow morning, everybody can come and catch the link. It will be posted in several different places. Sit down with your coffee, and then you can read through every tweet and every retweet and every response that was happening in this entire hour. So I would like to bring you to, I have a couple of questions that mean a lot to me. So we talk about the criminalization of people with mental health illness, and we see it all the time. There's some kind of tragedy, and the first thing out of either the reporter's mouth or sometimes even law enforcement is, well, must have been a mental health issue. Well, not necessarily always the case. and you've really talked about, mental health court being a diversionary court. So moving forward, if we all had that wonderful crystal ball, we have about 5 minutes to say, what's your vision? What's your vision for mental health, for social justice in America, in the courts and elsewhere? What's your vision?
Absolutely. Well, first of all, again, as I close and we do this wrap up, I wanted to thank you so much for this opportunity.
Oh, thank you.
It's so meaningful to me to be able to talk about, changing cultures in a courtroom, changing cultures in a workplace, changing cultures in an organization as big as a circuit court system. And we've come very, very far. For example, even in my circuit, in the 17th Circuit in Broward County. And I think that, our vision is the vision of really moving our systems of care forward, to understand that all Americans deserve excellence in mental health care, that we need parity, that we have to understand that mental health is essential to overall health, and yet we've also learned something else. And we learned something else, out of the CDC through Vital Signs in 2016 that is very, very important. And that is that we've got to be bold. We've got to be broad in terms of the dimensions in which we think in terms of social determinants of health. And that is that poverty matters, unemployment matters, race matters, gender matters, culture matters, where you live matters. Do you have clean water to drink matters? Do you have enough green space? Are you eating nutritiously? Are you getting enough sleep? Social determinants of health are really guiding us at this point. It's really our zip codes. It's, what do we have to understand now in terms of, it's not enough now just simply to talk about mental health. It's not even enough now to talk about suicide prevention. We have got to understand the impact, of what it means, to be under intense financial stress and distress. And what's the impact of that on parents and the corollary impact on children? And so I just feel that our vision has to be bold, it has to be broad, and again, it has to be prevention focused. And I think that, we have great leaders in this country across all sectors, and we really, really need champions. We need champions to stand up, and it's great that we have problem-solving courts, but we don't really want, the tail wagging the dog. We need to have systems of care on the front end that are functional, that are vibrant, that are welcoming, that are evidence-based, that are research-driven, that are technologically relevant. And so there's so much we can do, and I'm so excited, about the vision of the future.
Wow. How can anybody not be excited about it after hearing that? I'm just going to have a couple of things to offer. First of all, Judge Wen, thank you so much for coming on. It was interesting because when I first sat and had my first conversation with April Forman about stepping in to do this, she said, well, you've got to think about who you want on the program. And as I was sitting there that night saying, empty head, right? I turned and I looked, and there was the cover of your book. And I went, okay, well, there we go. We'll add Judge Wen to this. And then I sat and read it. And I think it's just so important. I love the fact that you champion normalizing the conversation, encouraging people to talk. There's just so much here. And yes, we have so much work to do, but I'm with you. I'm the perpetual Pollyanna. People want to smack me sometimes because no matter what's going on, I'll say, well, but look what happened over here. Look what we did. We saved a life, or we gave comfort to a family. And it is so hard. And I'm so glad to see so many people rolling through this conversation.
I just want to say too, I'm so grateful. I'm so grateful to the survivors. I'm so grateful to the family members. I'm so grateful to all the high school and middle school peers that, you know, are reaching out and talking to their fellow students and saying, hey, you know, is everything okay? And if it isn't, would you, you know, can we talk about it? And, you know, I feel that that's really that connectivity, that social human connection. That's where I think we all have the power to make a difference. And I'm so grateful for all the work that the families are doing and the survivor community is doing. And, you know, my book is a gift to the families, family members. You're not alone. You're never alone. It's important.
It is. And one of the things that when you're talking about that, we are looking here, the programs that we've been working on is to fill some of those gaps.
Exactly.
To help people, because we talk so much about, quote, hashtag suicide prevention. I'm a champion of, well, we need to improve the quality of life.
Yes.
So if there is a lost survivor, how do we help that person find a comfortable life with that discomfort, concussion always in their heart? What can we do what can we in the community do to support that?
Yes.
And with attempt survivors, how to help them keep striving to improve that quality of life. And I use Tracy often as the example, because her first 10 years after her last attempt were hell. They were not, there was no choice for life there. She muddled through because she was misdiagnosed and on the wrong medication. And that has changed. And this past summer, she got on a motorcycle with her motorcycle Patriot riders, and they rode the tail of the dragon. And that's all of these S curves within 11 miles on a mountainside.
Wow.
And my heart was in my mouth, and she started filming part of it. But, you know, when she finished it and she screamed and hollered in joy, her second statement was, I'm so glad I stayed to be able to do that. We have helped improve the quality of life. I think everything that you're doing in your courts and in your work, in your classroom, in your speaking engagements, just offers hope to families. My goal is, I hope that people will share this recorded chat tonight and share it with people and give families even more hope as we're going through.
Thank you. Yes, everybody has gifts and everybody has something to share. We want everybody here tomorrow. And
yes,
you know, it's so important. And thank you again for this extraordinary opportunity.
You're welcome. And so for everybody out there, we're going to say good night. The link to this full recording and the wakelet will go out in about an hour, because if I don't do it now, it won't get done. And Judge Wen, as I sign off, if you'll just hang in there for a couple of minutes after we sign off. Good night, everybody. Hey, Trace. Thank you.
Thank you, Tracy. Good night. Good night, everyone.
All right. Bye-bye.
Bye.